Well, hello everyone. Thank you very much for coming to this talk. It's really a great honor for us to present our work here today. Hello to the online audience as well. So what we will do tomorrow actually is, so to switch the slides, we will actually talk about something that has taken much of our time in the last, how many, two years, which is actually this motivation barometer that Alex talked about. And we will try to outline some aspects of this tool and some of the findings that have been gathered during this period. And I hope it will be informative and that you will find some interest in it. The outline of our talk will be twofold or threefold, if you want. First, we will describe the tool itself, which actually takes a bit of time. And then we will highlight, we tackled a lot of different issues. Alex mentioned a lot of waves of data collection. So we are only going to talk about two general themes, which is motivation and how it relates to with perception, motivation for health behavior during the COVID pandemic, and vaccination more specifically. And we will, if we get to that stage within the allotted time, which is really not sure, we will draw some lessons from using this tool. So let's maybe move on directly to the methodology, and the methodology can be, we will try to address 4 questions. And so here is the first one. Why is it important to monitor motivation and well-being during a pandemic? Then what is the methods? Who are the participants? How did we analyze the data? And how did we validate and disseminate the findings? And to address the first question, I will immediately give the floor to the other Olivier.
So I'm the other Olivier, and believe us, there are still other Olivier in Belgium, but we only were coming, but there are at least 2 other ones who can have been together with us today. So it's a real pleasure to be with you today and trying to explain you in a few minutes what was this motivation barometer. Actually, on March 19, 2020, the initiative started from a colleague from Ghent, who immediately started to collect data. We joined the initiative a bit later, but what is great is that really from the beginning of the pandemic, we have data available on the different topics that I will be presenting to you. Clearly, anyone surprised about that, the pandemic had a huge impact on people at the psychological level. The measures were highly intrusive for people's everyday life. The predictability was really low. There were up and downs. There were several waves and decisions of politicians that varied not only because of the level of infection, but also because of many other reasons, being also some external reasons, some pressure for the population also. So it was something with a very low level of controllability, and you know that low controllability is an ideal factor to raise anxiety and worries in the population. And the chronicity issue, of course, when we started, we didn't know that we were going to work on that for almost 2 years. And we had constant and unpredicted extension of our work throughout these years. So here is just to give you an idea of the different variables that were involved here. So we tried, yes, that's always the dilemma, but okay, so I will leave the people there just to show you some aspect, or I can use, is there a pointer somewhere? Yeah, okay. Okay, so objective circumstances, of course, infection numbers and what is called a stringency effect index, sorry. So getting an idea of how stringent were the measure in the country. The perceived contextual support, so all the questions related to the communication of the information and the trust in authorities. Then at the second layer, we quite extensively were looking at risk perception, and I will detail the type of measures we were including. Concerns, worries about the situation, and we will say a few words about the differential impact of risk perception and concerns on, for instance, motivation, but also the adherence to sanitary behaviors and vaccination. Olivier will say a few words about the role of basic needs. We paid a particular attention to psychological well-being. There could be two additional arrows here from well-being to adherence. It's just that these questions haven't been examined so far. We have the data, but there were so many aspects to look at that these aspects weren't looked at yet, but might be in the future. And I think it's you, Olivier.
Yeah. So, how did we proceed? So basically, the idea of the motivation barometer is that it's kind of a snapshot that will give you an idea of the temperature of the population at a specific moment in time during the pandemic. That was the idea of a kind of a camera that would show what the state of the population was during especially critical moments of the pandemic. In studying that, we were really motivated not to just look at outcomes, but to have from the beginning a process-oriented view. And I would say that this comes well even before we entered the barometer. I would say the main driver of this effort was Martin van Steenkiezer from Ghent, who is somebody who has worked a lot on self-determination theory. And so I would say that self-determination theory was really the central theory that organized most of our research. So basically, you have these outcomes. And for example, I would say the main outcome would be the adhesion to sanitary behaviors, including vaccination and well-being, as well as trying to understand the processes. And here, of course, we are particularly interested in the motivational factor that would lead people to adhere to this behavior that are, of course, very unusual. So you needed a lot of motivation sometimes to do it, you probably remember. And the other important aspect that's central to this theory, to basic needs theory, is, of course, the basic psychological needs and the satisfaction of these needs being a predictor of well-being. So, let me just very quickly, you are probably somewhat familiar with self-determination theory, but let me quickly remind you a few aspects of the theory. Basically, the idea is that there are different reasons that can induce people to perform a behavior. Some of them, I would say, are externally motivated, like punishment, rewards, etc. It can also be more guilt or you could call that almost internal punishment. I feel bad if I don't do it. But this is very different from what is called autonomous motivation. What I'm presenting here is called control motivation. It's an external factor that would lead you to perform the behavior. Whereas autonomous motivation is based on the idea that the behavior is really designed, it has meaning, you see why you are doing it, it aligns with your values, etc. So these are two kinds, very broadly defined categories of motivation. One we have called motivation and the other want-ivation. So you have, of course, a third category, which is lack of motivation. I don't want to do this anymore. I don't think it makes sense, etc., which is the opposite of the want-ivation, I would say. And it leads to discouragement, to apathy, etc. So the idea, of course, is that as you move from demotivation to motivation, people will increase their sense that the behavior is meaningful, that it's theirs to choose, and they will be more committed to this behavior. So you can really see a line from demotivation to autonomous motivation. The other, I would say, theoretical foundation here is basic needs that are predicted. The basic idea here is that people have a series of basic needs, and when these are fulfilled, this would lead to well-being. And the main needs here, I would say, are autonomy, relatedness, competence, and security in this theory. I will not elaborate a lot on that because we don't talk much about this data. So what about the methodology? So what we did basically is that we had a series of surveys in which we addressed a core set of topics that could vary a little during the pandemic. So these are the topics that were addressed in the surveys. And some of them were addressed to general populations, other to subcategories that were particularly relevant given the research question at hand. And we used a variety of methodologies, so some cross-sectional studies, just usual questionnaires at one time. We also used longitudinal studies. And something that we did quite a few times is also vignette-based intervention, in which we actually consider several policies that could be implemented and varying it and asking our participants to imagine how they would react to these policies. We did that quite a few times as well. So this allows us to answer a different set of questions. So the longitudinal design allowed us to predict on the long term whether motivational difference between individuals will predict their intention and uptake of vaccines, for example. The vignettes answered questions regarding different policies. So one example where for example, I will talk about that, about the mandatory vaccination, how would, before it was potentially implemented, how would people react to it? And we also considered there are some interventions that were informed by the barometer, which we will not discuss here, but notably on the effect of testing in schools. So how did it develop? Because I'm talking in the abstract here. So what is really interesting is that it started from, I said, this very small team in Ghent, and then it grew, and it became an inter-university and interdisciplinary collaboration between different branches of psychology. So motivation, health, social psychology. And so this is the whole team. Some of you might recognize Vincent Isorbit, another social psychologist who is involved in this team. And it's really a bottom-up approach. So nobody told us to do that. We just started, and it became really I would say a great adventure that progressively became embedded in a real organizational structure. So besides the motivation barometer, an expert group was put into place. So psychological scientists from all universities in Belgium who thought they could contribute something to to the emerging crisis, tried to group together to form what was called the expert group Psychology and Corona. We were also joined by members of professional organizations, and we would meet every week and to try to have some kind of common message that we could address to the policymakers. And the concrete research was done by the Motivation Barometer team, but there was really a dialogue between the two layers. And all of this was purely bottom-up, but as we met regularly and communicated a lot, our message really permeated and reached the authorities. And of course, we were also connected with other academics from other countries. And so I would say this is the general structure of the barometer, and I will now let, or is it me?
That's you.
Yeah.
Okay, I'm sure you have noticed the number of people participating. So maybe here rugby would be a more popular game with 15 players, but here we are a soccer-oriented country, so that's the reason we were 11 people in the research team. So here a few words about the participants. So we managed to have almost 500,000 of participants, at least when you were counting the different waves. A large part of them were unique participants, but as Olivier mentioned, we also had a longitudinal follow-up with a reasonably high amount of people. So we had more than 100 waves. At the beginning of the pandemic, it was daily collected, then it was more weekly connected, and then we adapted the data collection as a function of major changes in the policy or in the infection rate, for instance. So in total, the data collection, actually, it's even longer now because we are currently collecting new data in which we are progressively also switching to look at other issues that are worrying for people. Of course, there were other interesting issues that developed through the time, the war in Ukraine, climate issues, migration issues. So now also our will is to move progressively from what we call psychology and corona to psychology and society in order to address also some other issues. And that's the purpose of the current data collection. As usual in this kind of data collection, there was a majority of women, 64%. And I would say, unfortunately, also because we relied a lot on classical media, the mean age was relatively high. But due to the number of participants, we were still able to have a reasonably high amount of people who were younger. We tried also to collect the data across the country. And what is positive is that maybe contrary to some other studies, it was quite balanced regarding education. So we had about 1/3 of people with only a secondary school level, 1/3 with a bachelor level, and 1/3 with a master level. Interestingly, also, a key issue was the vaccination, the progressive vaccination of the population. But you see here that our numbers were not linearly following what was happening about vaccination. Clearly, the drops are simply due to the fact that, interestingly, it became also a source of motivation for non-vaccinated people because they had the sense that by participating to this motivation barometer, they can be heard from the authorities. And so that's why you can see these up and downs. It's really reflected also, I would say, the motivation of unvaccinated people to participate to the survey. We had different techniques to collect participants. Social media was one, and some main newspapers was another one. And we will go back to that. The contact with the press were also very important in order to transmit some important messages. Yes, these were the. So another interesting aspect is the dashboard that we computed based on different aspects. Here, this is in relation with motivation. What we try to do is actually each point is representing data collection and getting diachronic perspective on all the major issues that happened during the crisis. I will illustrate that a bit later, but then it gives an interesting visualization of all the major variables that we were considering. And so here it's, yes, sorry, the first one was, yes, it was motivation. Here it's by age group. Here it's also the evolution of motivation, but with some indication of key moments like beginning of lockdown 1, beginning of lockdown 2, formation of a new government. Each major event was visible on these graphs. And also, we wanted to make sure that we could publish reports that would be highly accessible for the general population. So we try to be quite explicit about the variables we were using. And each time we were also providing some concrete recommendations for the stakeholders and for the population in general. And we published in total 40 reports about various topics, as you can see here, because as Olivier explained, we had similar variables across the data collection, but depending of some moments, we were also adding some specific subsets of questions. So the reports were highly accessible. It was probably a unique opportunity to validate different psychological theories and make these psychological theories known to the journalists. So we try to educate these journalists who, after some months, were able to understand what it means, risk perception, autonomous motivation. By regularly being in contact with them, we developed a kind of psychology culture, I think, in some of the media in Belgium. I think it's still me, this one, yes. Yeah. So how were the findings validated, disseminated, and used during the crisis? So we also published opinion papers on a regular basis. And one, for instance, that I mentioned during the lunchtime to Winifred is a crazy decision of the government in February 2021. So that was after a long lockdown, and we could show that the population was really following the very stringent measures. But there was, because of the lockdown during Christmas, there were a lot of people lobbying to reopen shops, reopening restaurants, for instance, which have been closed for a long time. And the government really felt this pressure and had this very interesting naive idea that by releasing some of the measures, it will give a sense of freedom to the population and it will have a positive impact on their well-being. And so instead of reopening in a coherent way some activities, they decided early February that within 2 weeks, we will reopen the hairdressers. Why the hairdressers? Because the government had the idea that people were really needing that. It was, of course, not sustained by any reasons, because as you know, hairdresser means close contact, but the close contact sports were not allowed to restart, for instance. So instead of increasing the well-being and the motivation of the people, it created a huge drop in the motivation. And that was an opportunity for us to say that going to the hairdressers makes sense if the conditions will allow that, but at a time where the vaccine was not accessible, at a time when the infection was still high, just taking this single decision was actually a big mistake. I've already talked about the accessible report, opinion pieces, and regular media interventions in which we really get progressively this kind of brand of the Motivation Barometer. That was really also something we had to deal with, because after a few months, actually, we were constantly called by journalists who wanted to release the information. So we also had to deal with this unusual pressure for us. I must say also that the pressure of time for publishing the report was quite high because the situation was evolving so quickly that at some moment we couldn't wait more than 1 week because the week after the conditions were already quite different. We also wanted to make a website highly and easily accessible and easy to navigate. So now we have organized it by topics. And we also published some podcasts that try to explain in 3 languages, French, Dutch, and English, some of the main concepts that we have been using during the crisis. So we had a lot of contact with policymakers. One of us was in the advisory board of the Belgian authorities. Some of us were also involved in the parliament debate about compulsory vaccination. There was a task force for vaccination, and there were also, as you may know, that Belgium is a federal state, so it's not only at the state level, but at the region level that some important decisions were also made regarding health-related issues. So we had contacts, or we were involved in some of these instances, which offered us a unique opportunity to understand also on which basis some of the decisions were taken. And one aspect on which we were insisting a lot from the fall of 2020 was the implementation of a Corona Barometer, something, if I'm right, that has been implemented in New Zealand quite early in the process. But here, what is interesting is that the idea was to fix some limits, to have, using the color of a traffic light, green, orange, and red. And these different colors would be actually decided on key issues about, for instance, the number of people at hospital, the number of people in emergency care units. And when this threshold were reached, then automatically there would be a change in the policy, so that would help people to have a better control on the situation, rather than this crazy meeting where you had all the lobbyists trying to convince the different levels of the government to release some aspects, while others were trying to make everything closed. So the idea of this Corona Barometer was already expressed in the fall of 2020, and it was only implemented in February 2022, when the situation was already improving. So that's also showing that despite the fact that we thought we had some influence, a decision like that one took a horrible or long time to be implemented, which was showing us all the obstacles between recommendation based on empirical basis and the decision of the political authorities. And of course, we were also publishing on, I would say, classical outlets. But I think what was interesting for us is that coming from different backgrounds, clinical psychology, health psychology, motivation, social psychology, it broadened up the scope of the different outlets we were publishing. So as you can see, it was quite varied. Health psychology would be one, health communication, vaccine, or social sciences and medicine are outlets that are actually targeting a different audience. And that also was something very interesting and sometimes a little bit challenging. So now we will move with the illustration of 2 research topics, the question of motivation and risk perception, and after Olivier will present the question of vaccination. So 2 main questions, the factors that will affect motivation, and looking at the question about, are stricter measures necessarily having an impact about the demotivation of the population? So regarding the factors that affected motivation, we tried to look at different levels. We were interested by social norms and the influence that these social norms had on the different behaviors. And indeed, it had a clear role. But we were also looking at a sense of competence, self-efficacy. That was another aspect, together with a lot of attention to the question of trust in public authorities and comparing the trust into different sources, being the scientific experts, being the GP, being the pharmacist. So we had a large variety of different sources, and we were looking at the change in this trust throughout the pandemic and the determinants of this change in the trust in those sources. And also the epidemiological situation, together with the subjective perception of risk that people were considering about getting the disease, and also we will see the severity of the disease. And regarding the question of stricter measures related to motivation, of course, you won't be surprised, there is no linear relation, but that was also something important to show, because in the public, in the media, there was initially this idea that this was something totally automatically related. And of course, people are going to follow the measures only if they find meaning and if they find some coherence in these measures. So here I'm just going to illustrate these different moments when we are looking at the link between motivation and adherence here. You could see in the rectangle on the far left, the green ones, that when the lockdown started, in blue, you have autonomous motivation was extremely high, controlled motivation and motivation were low. At the same time, people were really inclined to follow the measures. Of course, that was a moment of intense fear, and people didn't want to take any risk. Then we moved to a critical moment in Belgium, which was September 2020. A moment of high political pressure. There was a change in government, and the previous government, before finishing their office, decided to release the measures and extending the number of close contacts. But that came at a moment of a new wave was starting, and you could see on the top that autonomous motivation was really dropping, and at the same time, adherence to the measures were dropping, which had a very bad impact. You can see, for instance, in red, you have the question of restricting the number of social contacts. People were not ready anymore to follow this, despite the fact that the number of infection was dramatically increasing. But the problem is that the communication of the public authorities was so disastrous at that moment, because of saying, okay, we understand that you need to have more contacts, so now we will go from a limitation of 5 contacts that are the same across the time to 15 contacts that can change every week. That was totally in opposition with the situation, and so it had a very bad impact. On the contrary, when there was some clear explanation about the reason to have very strict measures during Christmas 2020, you can say that autonomous motivation is quite high, despite the fact that the measures were extremely severe. People could only have 1 external contact for Christmas. They could only invite 1 person in the house. And despite of that, the following of the measures during that time was extremely high. Then February 2021, I will not go into that into detail. That's the moment of the hairdressers. And you see here again, drop in motivation, drop in the adherence to the different measures. And finally, the last wave, in which there is congruency between the measures that are released and the fact that there are less risk at that moment, and so autonomous motivation was again very high. And interesting, despite the fact that it was the end of the peak, people were again more motivated to follow the different measures. So it had some impact about the communication, having an empathic communication, which was most of the time the case for the government, but not always, and have also a more personal approach of motivation. I don't know how we are dealing with time. Okay, it's good to know, so we can manage the time. Okay, perfect. So about risk perception, risk perception is a subjective feelings about threats that are related to health. And of course, if your level of risk perception is extremely low, there are not really reasons that you will be motivated to follow the measures that have been implemented. In the assessment, we always made a distinction between the risk for oneself and the risk for the population. You won't be surprised as social psychologists that there was a discrepancy between both and that people constantly underestimated their personal risk and make them always lower than the risk for the population. And we also always made a distinction between the probability of becoming infected and the severity of the illness. And we also always assess together with risk perception concerns that are related to more clinical issues of worries, anxiety, and you will see that these two variables have a different role on the motivation and on the following of the different measure. So the different measures are the classical one about washing the hand, face mask wearing, or maintaining the physical distance. And here we can see in this graph that the number of infection and hospitalization was a trigger for increasing risk perception and concern at the same time. But interestingly, risk perception was positively related to the adherence to the measures, both directly and indirectly through autonomous motivation, while the level of concern was negatively related to autonomous motivation. So when people were too worried about the situation, their internal motivation decreased. And also the problem was that we identified a direct effect of worries on adherence, a negative one. So being too worried about the situation demotivated people to follow these different measures. And again, there were different critical moments in this evolution of risk perception. In October 2020, that was the moment in which this risk perception increased with the Delta variant and then the Omicron variant. There was also an increase, but interestingly, and I will come back to that, there was some dissociation between risk of infection and severity of infection. I will not go back to that because I will already explain it. So when Omicron arrived, it really changed the situation because before that, as you can see, the curves for here it's only at the population level for risk of infection and severity of infection were remarkably parallel. But suddenly, with the start of the Delta variant, you see this discrepancy. So people estimated that the risk of being infected was actually increasing, but the severity was decreasing. And as you will see, it had some impact on the following of the sanitary measures. Because here, when you are looking at the different phases of the pandemic, and you look at the link between risk perception and on the top autonomous motivation and on the bottom adherence to the measures, you see that progressively severity is taking the lead, being the best predictor of both autonomous motivation and adherence, and the risk of being infected playing a lower role. So that was interesting to see this dissociation occurring during the moment that new variants were appearing. And so it had different policy implications that fear messages need to be avoided, although they have been sometimes used, especially at the moment that the policymakers had no control anymore on the situation. That informing about risk, it's something that is very useful, that needs some concrete visuals also to get an idea of what would be the consequences of different level of this risk perception on the evolution of the infection in the country. We try also to make people aware that they had also to develop their own control about the situation. And if we take the mask wearing, for instance, being aware that the inside, outside, many people, few people, low ventilation, high ventilation are critical issues that will affect the risk of getting the virus. Also using the if-then scenario, trying to help people to forecast some possible scenario and help them to realize which solution will be the best for them in order to balance the risk perception and their well-being. Also insist on the severity of the infection for the vulnerable populations who might want to adopt some different rules than others. And also being clear that virus circulation had disadvantages, of course, for physical health, because then it will have an impact on the healthcare system, but also insist on the fact that increasing virus circulation will also have an indirect mental health effect, because among other, it will mean closing schools, and it's clear that closing schools had a major impact on the mental health of the youngster population. So making aware the population and the policymakers of this high risk, if there was a temptation to continue letting the virus circulating freely. And I'll give the floor to Olivier for the vaccination issue.
Thank you, Olivier. So I will give a snapshot here of a few things we have tried to do, because if I go into detail, it will be really difficult to keep the time. Here are a few questions that we tried to answer during this pandemic. So the first one was just to track the evolution of support for vaccination. So as soon as a vaccine was in sight, we started asking people about their intentions for vaccination, usually a 5-point scale. And so we could follow and that we did longitudinally, we could follow the willingness over time. And you can see that the red ones are the ones who say, oh, whatever happens, I will refuse to get vaccinated. And there is a difference between the Dutch-speaking and the French-speaking in Belgium. The Dutch-speaking are much more likely to abide with what the authorities say. But anyway, overall, what we see, and what is really interesting is that even the people who said they would not get vaccinated and who refused, actually they ended up, as the survey evolved, as the time evolved, being willing to get vaccinated. So we really have an evolution here. And we could also track how people move from one category to the other as the pandemic evolved. So there was this small category of hardcore refuser that stayed, but most of the others actually moved in the other category. So what factor influenced the intention to get vaccinated? So rather than giving you the details of the finding, I think the process is actually interesting how we address this question. So one question one way we address this is through the vignette approach. We did, since we had access to a very big sample, something we did was actually do a huge experiment where we manipulate all kinds of aspects of a vaccine, like does it have side effects? Is it efficient? Is it being, so that we did in January 2021, so when nobody was vaccinated yet, whether it takes a lot of effort, how many doses you have to take, information about social norms. So we really, it was almost here very exploratory. So we used all these independent variables, cross them. We had a huge number of groups, I think 300 groups or something like that, by crossing all the variables. And then we try to see basically what factors were most influential and which didn't have an effect at all. So what we found here basically is something that we expected at the motivational level, that autonomous motivation was central, and we distrust having a negative effect. And obviously, the confidence in the vaccine, as much of the literature on vaccination shows, was really the strongest effect. I must say the effect sizes for this vignette study were quite small. Another one we did was also guided by the current situation. was to look at the kind of communication style healthcare worker could use to communicate about the vaccine, so either more autonomy supportive or more controlling. And it was a moment where the authorities were discussing about external rewards, like a voucher, a pass that would allow you to access some activities, etc., or a control condition where there was nothing. And so we examined which of these situations were more likely to increase the intentions to get vaccinated in this scenario study. Again, the autonomy and enhancing communication style was the most efficient, and the external rewards had very little effects. So this idea of autonomy was really important, and the effects were mediated by autonomy satisfaction. Another finding that also interesting was relative to the booster. Again, that was guided by the actuality of this question. And it was also done longitudinally. And something that is quite interesting, that paper is not published yet, is that actually we could track the motivation for the first dose. We had the information, and we could predict booster acceptance many months later, I think probably even a year later. And autonomous motivation for the first dose predicted booster acceptance much later, whereas the controlled motivation actually has, for the first dose, actually had a negative predictive impact on booster acceptance. So it really shows that the meaning you accord to vaccination, and the fact that you do it because it's important, because it accords with your values, is really central. I think this is the message that's grounded here in self-determination theory, but that you could quickly, easily apply also to the social identity approach, for example. So something we also did, and I will not maybe talk in detail about that, is to look at the relation between conspiracy theories, government trust, and vaccination. So something that has been studied heavily. There is a lot of papers on that. But we looked at the mediating role of motivation, and we showed that actually, when you have trust in the government, it fosters autonomous motivation. Because you have trust that what you are doing has meaning, and that what they are saying is not just an external incentive, but something that really accords with what is good for you and for society as a whole. So this is a paper that I'm happy to share, and that is here to and conspiracy theory have more or less the opposite effect. Another thing we did a lot during the pandemic is look at who did people trust regarding vaccination, and clearly the closest, the most trustworthy, the family doctor and pharmacists, scientific experts are much more trusted than either celebrities or politicians or just an unknown group member who got vaccinated. So it's important for communication. We also did some studies on how people responded to restrictive policies. And the process was interesting here. And given time, I'm not going to detail the results, but at one point there was a parliamentary commission where we had to, some of us, Vincent and Martin, talked about whether compulsory vaccination was a good or a bad idea from a psychological perspective. What could we say about it? And so we could make a study on that and on how people would react to very restrictive measures, and inform our intervention in the parliament on the data we had just collected. So that was really I think, a very interesting process. And yeah, so basically what we found through this range of studies, I think, is that autonomous motivation and trust in authorities go together, and that they will facilitate vaccination intention, that we should really cooperate with healthcare workers who are the greatest source of trust for vaccination-related messages. And Olivier talked a lot about the importance of risk perception as opposed to just concerns and anxiety about the future. The barometer tool that we talked about is also a way to respond to this, because it highlights risk in a very visual way. It gives you kind of a map of where we are and what we need to achieve to reach our goal.